I gave a recent lecture in Utah. Had a good time, by the way. Hello to the St. George, Utah people. The conference is called Healthy Living, and I was sent there by the Super Patch Company as a representative because I sit on the medical advisory board and to share our non-medicated physical therapy devices to the world. And the people who attend these healthy living conferences are typically interested in all different aspects of health and wellness. My analogy as I introduce the technology to the world is that the modern healthcare system is the equivalent of life pushing people off a cliff, and then we just kind of sit there and wait for them to hit the bottom, and then that's where the ambulance is to like cart the people away. Nothing is done to prevent these people from falling off the cliff. So, of course, I took some interest in this particular headline that we're spending trillions on healthcare, yet remain unwell. In fact, we're more unwell now than ever. And this article pretty much says that same philosophy. Like, we are spending our lives and all these millions of dollars putting out little baby fires. You have to understand how the healthcare, how we're trained as physicians. As a general rule, human beings are reactive. And reaction oftentimes comes too late and it comes at a price. So whether we're reacting and you're getting a prescription, or we're reacting and you're getting an herb, or we're reacting and you get, acupuncture or some other therapy, you may have waited too long and it's expensive. It doesn't make you any better. And the reality is, prevention is not a trip to your doctor or your wellness person or, your aromatherapy person or any of that. That is not your healthcare. Your wellness on a day-to-day basis is understanding that your daily activities are your healthcare. Now, healthcare insurance is is an insurance, a bet against disaster. And we have turned a bet against disaster into a coupon for intervention. So when you have a coupon for intervention, you tend to use it. If it's a bet against a disaster, you tend to not use it. Why can you only get a health savings account if you only have certain types of insurance? Anyone should be able to get a health savings account no matter what. Why is it attached to an insurance policy? If I have great insurance, I should also be able to save money for health expenditures, for my dental care, which, by the way, is critical to medical health. You have no idea how important oral health is to your full body health. Why do we not get an extra time in our day in the schools? Why did they take PE out of the schools? Why am I exposed to fluorescent lighting? I've spent the last 30 years under fluorescent lighting. 100% that has messed with my body. All of these things should be covered, in the Anna dream world. All of those things are covered by a health savings account. Now, it's not covered by a health savings account because A, the government wants their tax money. You haven't been taxed enough that you got to be taxed on everything, right? So that's lesson number one. And reason number two, because the pharmaceutical industry and the insurance industry, which, by the way, are in cahoots, just so you know, they own massive medical systems, which own now all of the doctors. And what is interesting is all of that cabal was written into law that passed in 2010. The quote unquote Affordable Care Act only made everything more expensive. All the cuts came up front to small medical practices, which by necessity joined bigger and bigger practices, which were ultimately captured by these huge corporate entities, which also own the hospital, all the testing services, and guess what? The pharmacies. And the same investor that owns the medical industry owns the insurance company. See, it's like to see how they captured the entire thing. It's not in their interest that you would go work out or have clean water, and God forbid that you would have food that is not sprayed with chemicals. It's one of the reasons that I started this channel. It's one of the reasons why I put out a lot of free information. A lot of the companies that I sit on the medical advisory board for are in that same mindset that we need to prevent illness by proper nutrition and non-medical intervention before we go reaching for the medical intervention. It would certainly save us a lot of money as a nation, but it would make you feel better. And I know it's not easy to think about doing these things, but it's worth it. And so check out our website, drannatoker.com. Go to the doctor approved area and kind of look through our sponsors. Yes, those are awesome companies, but then look for the apps that we have where you can scan your food to see if it's organic, not organic, are there toxins there? There's one for supplements also. And then keep scrolling down and you'll see some food delivery services if you're like me and you live in the country. And you can keep scrolling down. I have some actual online wellness programs. And if you're interested in any of this content, of course, you can subscribe to our weekly program called Gut Check, where I send out a little informational once a week. And then we have a Signal app group where you can ask me questions and we go into deep dives in a lot of these little content concepts over time. All right. And I hope to see you guys there.